Welcome, my name is Marie Stanton. I'm one of the senior lecturers and admissions lead for operating department practice here at Sheffield Hallam University. I'd just like to take a few moments to talk to you about the course and working in the perioperative environment. This environment encompasses all aspects of patient care, from pre-op assessment through to them undergoing their surgical procedure and any anaesthetic intervention until they go into the post-operative care environment and then ultimately back up to the ward. Whilst you're in theatres, you do work with a multitude of different professions, from surgeons to anaesthetists, healthcare assistants, nurses, porters, and obviously other operating department practitioners, such as myself. I am an ODP, and this is obviously the course that you're interested in finding out a little bit more about. Because you work with what we call multidisciplinary team members, other professions, as part of your time at Sheffield Hallam University, we do train you alongside other professions such as nurses, midwives, paramedics, physios, so that you can learn with, from and about them. This enables you to learn about the full care provision that we give to our patients and see about their full patient journey, for where they were before they came to theatre and where their care pathway takes them afterwards. We feel that this is really important, that you know the full journey for patient care. ODPs are the only healthcare professionals that are trained specifically to work in theatre. And the job is very, very exciting. It's very rewarding. It's very interesting. And no 2 days are the same. It can change in a heartbeat, from you being relatively quiet to an emergency coming through the door, if you work in emergencies. But equally, if you are in a planned procedure, things can be going quite smoothly to an untoward event happening. So you can never really relax, in the sense that you can presume everything's going to be absolutely fine. It's a very, very interesting and rewarding job. I can't impress on you that enough. I obviously, you can see I love my job. So yeah, being an ODP is a very exciting and rewarding profession. So what are ODPs? We are part of a bigger allied health professional family. There are 14 of us in total. Occupational therapists are one, paramedics, physios, just to name but a few. You are also registered with the Health and Care Professionals Council. You have your codes of conduct and standards of proficiency that you have to abide by. But this is not just when you are qualified. As students, you also have standards of proficiency that you have to adhere to. So you are governed even as students as well. You are trained in perioperative care, as I've mentioned previously, and this includes your core areas of anaesthetic, surgery and recovery. So the three core roles, as I've just mentioned, receive clinical and theoretical training throughout your time with us at Sheffield Hallam University. Now, we don't expect you to know all about these from the second that you arrive in university. That's why you're training, that's why you're with us for 3 years. And we build upon this from year 1 into year 2 and into year 3. We assess you in a multitude of different methods. These are written assignments, face tests and presentations. Now, the good thing about this is it encompasses all different learning styles, and we find that there's something that suits everybody, which is a good thing. Now, you don't just find ODPs in theatre, you will find ODPs in A&E, looking after patients that have been brought in via ambulance and by paramedics. So this is another time that you work with those different multi-professionals. You will find ODPs doing hospital transfers via ambulance, so from one hospital to another, where airway management is required. You will find us doing hospital transfers throughout the hospital, so from A&E to scan, or from A&E up to ITU to theatres, etc. And you will also find ODPs that actually work on intensive care units as well. So as I said, the role is very diverse and very interesting. But once you've qualified, it doesn't either if you decide you don't just want to work in the role of the ODP. There's lots more available to you. It's generally that you stay in the role of ODP for 3 years, really consolidate those skills, get a good understanding of the role. But then postgraduate wise, there's the physician's assistant in anaesthesia, there's a surgical first assistant role. But if you want to move away from clinical, you could move into education, such as what I did. Some of us still do some clinical role as well, so you don't have to leave the clinical behind altogether. There's management roles, you can move into management. So there's a plethora of things that are available to you once you have qualified, if you want to continue with your studies and continue to develop professionally as well. So how do you become an ODP? Well, really, it's quite simple. It's about getting your head down, working hard and securing those grades. What we ask for entry onto the course is 112 UCAS points, and those GCSEs, grade C or equivalent in English, maths and science, and some work experience. But that work experience doesn't have to necessarily be in a care environment, because we know that can be quite tricky, and getting into theatres for that work experience is almost impossible, and we appreciate that. But if you have been in a coffee shop or a situation where you work with customer service, then those are transferable skills. So don't dismiss those skills, write those on your personal statement, because we do look favourably on those as well. We also ask that you have some knowledge of NHS values, so those are important as well. I've talked to you as we've gone along about how I find the role of the ODP. I think it's quite clear that I enthuse about my profession, and obviously I'm going to love the job that I do. But don't just take my word for it. We have a video clip of our students talking about their training and how they feel about it. So listen to what they have to say as well, because I want you to get another perspective, not just mine. I think that's important. So just have a look at that little video clip, and that's called The Role of the ODP. So take a few moments to look at that. There's some further information on our website, so please take a look there as well, and that's all about being a prospective student and information on applying and things there. Or follow us on Twitter, where we will update you and keep you abreast of things that are happening and what's going on with the course, etc. If you do have any further questions or anything that I've mentioned and you want to know a little bit more about it, please come along and talk to us. There's going to be staff and students available on live chat all day, and I look forward to speaking to you a little later. Please take care, stay safe, and enjoy the rest of the day. Thank you.